Again, we have another barrier method similar to the diaphragm, but it comes with a slightly different shape because it's a whole circular shape here without this cacon here. So, which we call them cervical cap. They mainly function the same as diaphragm because it's a cup-shaped latex device that fits over the base of the cervix. A groove of the inner circumference of the limb improves the seal between the inner limb of the cup and the base of the cervix. So the cup must be filled on third full with spermicidal prior to insertion. So what I'm saying, the cup, once you place the cup inside, it has some cover outside. It has some portrait which displays which resembles the cervix. So on that small portrait part of the cup, you should place some spermicide of up to a third full of that cup. It is inserted as long as 8 hours before coitus and can be left in place for longer periods of up to 48 hours. So the cervical cap acts as both mechanical and barrier to the sperm migration into the cervical canal, and also as a chemical agent with the use of the spermicide which you apply. So the efficacy, it's a bit similar to that of diaphragm, whereby the effective rate for nullipalas is usually a bit higher, of up to 9%, with at least 9% failure rate when you are nullipalas, and with multiple palas women, it increases the failure rate to up to 20%. That's if you have gotten pregnant, or if you have given birth to more kids, or even to one kid and more. It continues. As you give birth, it continues increasing the failure rate. And this is commonly because of the a bit widened cervix as much as you give birth. So the disadvantage, the advantage of this cervical cap is to provide continuous contraception protection for the duration of use, regardless of the number of intercourse acts. So once you place it, it will provide protection. Again, unlike the diaphragm, additional spermicide is not necessary for the repeated intercourse. So once you place the spermicide before you insert, it's usually safe until you finish your intercourse. Again, the cervical cap does not involve ongoing use of hormones. So again, we said the barrier methods, not almost all of the barrier methods, they don't have hormonal effects. So what I'm saying, it doesn't involve the ongoing use of hormones. The disadvantage may be it may cause some cervical erosion and may lead to vaginal spotting. The cervical cap is associated with the cervical cap also may cause the shock if it's left for longer than 48 hours. And then the cervical cap also requires some professional fitting and training for the use. Severe obesity, if you are too much obese, may make the placement difficult. Thus, it has a relatively high failure rate also in the obese population. Again, you should note that candidate must have a history of normal results of pap test. So before you use, you should be screened for pap, and it should be normal before you use it. So the last barrier method that you're going to check is spermicidal agent, which with our current generation, it has become one of the most commonly used barrier method for for women who have male clients who don't like using the condoms. So the vaginal spermicide consists of a base combined of either non-oxynol or octoxynol agents. The actual spermicidal agent consists of a surfactant that destroys the sperm cell membrane. So the agents we mentioned before will destroy the sperm cell membrane. So the spermicidal agents may come in different forms, like it may come with as a vaginal form, it may come as a suppository, the small bullet-like tablets. It may come as a jelly, or which resembles the lubricant jellies. It may come as a tablet. It may come as a cream or as a film. This must be inserted into the vagina prior to each coital act. So you should press the chemical agents before you have sex, and like other people who try to put it after sex. So the adverse effects include disruption of vaginal epithelium, possibly by raising the risk of sexually transmitted infection. You'll find out it will erode some chemicals in the vaginal canal, and thus it will increase the risk of getting sexually transmitted infection. Also, it increases vaginal colonization with the E. coli, which will predispose to bacterial infection after an intercourse. So again, the spermicide will increase the E. coli colonization. It will increase the number of E. coli bacteria in the vaginal canal, thus which may increase the risk of having a bacterial infection after coitus. Spermicides prevent sperm from entering the cervix by attacking the sperm flagella and the body. So when they affect the sperm, they reduce the mobility and they disrupt the nourishment, thus making the sperm unviable and preventing it from flowing into the ovum. So efficacy, we say within the first year, it's effective with a failure rate of 6% and lower. But typically, if you continue using for long periods of time, sometimes the efficacy rate may be, efficacy rate, failure rate within the first year is estimated to be 6%, but some who have reported of failure rate of up to 26%. Some studies have shown failure rate of up to 26%. Advantage is that most of the spermicide the lubrication provided by the spermicide may heighten the satisfaction into both partners. So most of the spermicide will add the lubrication, which makes it more enjoyable for both partners during the sex act. Other advantage is it easily acts as a lubricant. Either partner can purchase and apply the spermicide because it's easily accessible and available as an over-counter, and it's inexpensive. Applying spermicide requires minimum patient education, so you can easily learn how to use it. It augments contraception efficacy of the cervical cap and diaphragm. So spermicide produce no adverse system effects. Disadvantages, spermicide may increase the risk of STI, as we said, because it increases the activation of E. coli, and also it increases the risk of, it reduces the immunity once you introduce the chemical agents. Again, insertion of may be uncomfortable to some couples. Some find it being irritating, and some may react to it, have some allergic reaction. As we said, it's a chemical, so some bodies may react to it. So effectiveness of spermicide lasts for less than an hour. So we even encourage after every 30 minutes, it's good you apply some more spermicides if you are continuing having the sex. So that marks the end of our barrier methods. In case you have any question, any comment, please drop, and then we shall review according to your question. Thank you very much for joining our class today, and keep coming in and in to get more contents on how to better our health. Thank you so much. and I will look forward to responding to your question, which will slip in on the comment section. Thank you. Thank you so much for watching this video. I hope you have been enlightened. Kindly subscribe to have an access to more of my upcoming classes on diverse health and lifestyle tips. In case you have a specific topic you want handled, or specific question you would like answered, or even get clarification on something I've said on my videos, please drop it on the comment section and I'll be prompt to give you responses. For appointment and private session, contact me via details on the video and I'll be ready to assist you. Thank you again for choosing me to guide you on health and lifestyle. This is King Mash. See you on the next one.